Depression, Family Medical Center. Myth: hard work beats depression. Depression affects nearly 1 in 6 people in their lifetime. One myth is that working harder will make you feel better. Overworking can actually be a sign of clinical depression, especially in men. Myth: it's not a real illness. Depression is a serious medical condition. It's often still confused with ordinary sadness. Key brain chemicals appear to be out of balance in depressed people. Fact: men fly under the radar. Depressed men are less likely to talk about their feelings. They may appear irritable, angry, or restless. They may cope by drinking, drugs, or reckless behavior. Myth: depression is just self-pity. People who have clinical depression are not lazy or simply feeling sorry for themselves. Depression is a medical illness. It usually improves with appropriate treatment. Fact: anyone can be depressed. Anyone from any background can develop depression. The illness is twice as common in women, but may be due to women being more likely to seek help. Tough personal experiences can trigger depression. It can creep up slowly or be a sudden illness. Myth: help means drugs for life. Medication is only one of the tools used to lift depression. Asking for help does not mean taking prescription drugs. Even if you do take antidepressants, it probably won't be for life. Myth: depressed people cry a lot. Some people don't even cry or act terribly sad when they're depressed. They may feel worthless or useless. Even without dramatic symptoms, untreated depression affects daily life. Fact: family history is not destiny. If depression is in your family history, it does not mean you are certain to develop the disorder. Watch for early symptoms. Take action when signs appear. Myth: talking makes things worse. There is evidence that guided discussions with a professional can make things better. Talk to a mental health professional. Fact: positive thinking may help. Focusing on the positive can ease depression. By using therapy, replace negative behavior with upbeat thoughts and a more positive mood. Myth: teens are unhappy by nature. Although many teens can be moody and argumentative, prolonged sadness is not normal for teens. Unhappiness lasting more than 2 weeks may be a sign of depression. Signs can be a sudden drop in grades or taking no pleasure in favorite activities. Fact: exercise is good medicine. Regular, moderately intense exercise can improve symptoms of depression. They can work just as well as medicine for people with mild depression. Exercising with a group adds social support. Myth: depression is tough to treat. Most people who take action to lift their depression do get better. Medications and talk therapy have been proven to be effective. Fact: it's not always depression. Some life events cause sadness or disappointment, but do not become clinical depression. Grief is normal after a death or divorce. Sadness every day for most of the day can be a sign of a need for treatment. Fact: depression can lift. In a depressed state, people may think there's no hope for things to get better. With treatment, sleep and appetite often improve as the depressed mood lifts. Family Medical Center 2931 20th Avenue South, Lethbridge.